to episode 59 of the Dental Realist podcast. I am Dr. Ryder Waldron. I'm joined as usual by Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going tonight?
Doing really well. I didn't have to do any work today, so that was kind of nice.
Wow, slacker.
Good, nice day off. It was only, 70 some degrees today, too. It's really kind of right up your alley, Ryder. You're like that cold weather, that Antarctic weather.
Warm. Still a little warm, but we had a lot of rain here today, so I was really happy about that. Marcus, how are you doing?
I'm doing all right. It's been cold and rainy here today too.
Nice. Looks like you got a little crock pot in the background there.
Yeah, you know, when my daughter moved home from school, she brought all of her stuff and it's ended up in this room. So
nice.
Got a little crock pot back here. I'm gonna just cook up a little something while we visit.
There you go.
Marcus is going to do a culinary podcast as well as a dental podcast at the same time.
Right. He's a great cook.
Yeah, Marcus
I do like to cook.
He likes to cook. He cooks in the dental operatory and in the kitchen. He gets it done. Did you work today, Marcus? You had a good day at dentistry, I'm assuming. Why don't you tell us one good thing that happened at the dental office today?
One good thing that happened at the dental office today is that I only had to do exams.
Oh wow, nice.
Yeah. No assistant, unfortunately.
You guys are short on assistants right now?
We are. I mean, this isn't what we were planning on talking about tonight, but man, it just sure seems like there's a lot of help wanted signs out everywhere, and I don't know how everybody else's dental practices are, but we've got a couple of new assistants starting next week, so that'll get us back up closer to having our full staff.
Our Pizza Hut over here has a big banner out front that says that they're hiring for $15 to $20 an hour. I'm like, well, I'm going to lose all of my assistants.
Yeah, my son's been working in my office a little this summer, and he'll drive by like Panda Express or McDonald's, and he'll say, "Dad, I could go make more working at McDonald's than you pay me at your office." And that's true right now. Like, you really could work at some of these places and make more money.
Crazy.
Yeah,
crazy.
It is weird. Well, should we get into our real topic tonight, guys?
Let's do this.
We're going to talk about some ethical obligations when you see subpar dentistry in a patient's mouth that's come to your office. So we've had enough experience now that we've had this happen to us probably several times over. So I want to see how you guys handle this and see if we can help our listeners kind of get through this, because this is kind of a stressful thing, especially for new dentists. So, okay, Troy, I'm going to start with you. And let's say you have a patient come in your office and they have just gotten some work done in another office. Either they came to get a second opinion from you, or they, maybe they moved in from out of state, and you see that there is some subpar work in their mouth. Maybe they have some open margins, whatever it may be. But how do you approach the subject with them and open that up to explain to them that they've had some bad dental work done, or maybe not bad dental work, but it just had a bad outcome?
Yeah, I don't ever refer to it as bad dental work, because I don't throw anybody under the bus, because I'm sure that there's times out there that mine hasn't looked that great either. So yeah, what I like to do is just basically explain and show them on x-rays, and kind of explain what's going on. Once they, it's interesting once you show someone visible, visual stuff, either x-rays or an intraoral picture or something like that, you can usually get them to get a little bit better on board than them just thinking, oh yeah, Dr. Stevens just wants a new boat or whatever like that. So, but what I like to do is show them, explain it to them. The thing that I don't like is when they tell me that the filling was just put in, just before they moved here or something like that. That's when it becomes problematic, because then the insurance isn't going to cover it and it's going to be all out of pocket. So that's a very tricky slope to get on. But I do everything I can to not throw anybody under the bus, because I don't think anybody out there is perfect.
Yeah, and that's excellent, because we've probably all had something not turn out right. And so Marcus, what's the next step that follow up from where Troy left off, that you see something that needs to be fixed in a person's mouth? You've identified it, you've explained it to the patient. What's the next step after that? If the patient says, well, I just had that crown put in, I just had that filling done 2 months ago, where do you go from there?
Yeah, like Troy, I really try to avoid, you know, throwing anybody under the bus or bad mouthing somebody else. Like he said, I know that I've done some things. I'm sure I have that somebody else is looking at, going, "Who in the heck is this guy? That guy's a hack." So I'll usually, if I've told them and they're like, "Man, that was just done, really." I usually say, I don't know what this tooth looked like before. I don't know the circumstances leading up to today. All I can comment on is what I see today, and this is what I see. It's unfortunate that this tooth's going to need treated so soon, but that's just the reality of what I'm seeing. I just try to be really, you know, just say this is what it is today. That's all I can comment on. That's all I can really tell you about because I don't know everything else about this tooth.
Yeah, I like that because we've all had the patients come in and give some story about, they did this or, they did that. I had a patient recently that came in with the bridge off. I think it was like 9 to 11. And he just walked in my office like at 5 o'clock when I was leaving my office. And he said, the other dentist just put this in and it just fell out. And I said, well, what other dentist? Because this guy's been coming to my office for a few years now. And I said, what other dentist? Oh, the one in Washington. I thought, okay, like, let me look at that. And I said, well, how long ago did you do this? Well, it's been 2 years now. And I told him I didn't want another bridge. I didn't want a new bridge. And he said I had to have a new bridge. So he did it. And now it's fallen out. I'm like, okay, so, after, a situation like that and they're blaming other dentists, at what point do you guys call the previous dentist and have a discussion about things? Like, is there something that makes you call them or not call them, or what would make you have a conversation with the previous dentist?
Man, I'm trying to think about that because I feel like I've done that. I've called the previous dentist, but it's been so long since I've done that that I can't even remember the circumstances of what it entailed. But I think I might call if the person was saying, you know what, I'm going to go back to the other dentist and talk to him about this or whatever.
Yeah.
That's probably a time that I would maybe call and say, hey, I just wanted to give you a heads up. This person was in, they're a mutual patient. This is what I saw today, and they seemed a little bit upset. All I told them was that this is what I was seeing. Feel free to take a look at it. If you see it differently, that's totally fine with me. But this is what I told the patient I saw and thought needed to be done.
Yeah.
I I,
Yeah.
I wouldn't get into holy crap, dude, what did you
What were
do?
you thinking?
I definitely wouldn't do something like that. I mean, you're
Yeah.
looking for a fight then, but.
Yeah. Yeah, Troy, is there something that would make you call the other dentist or something that would make you avoid calling the other dentist?
Yeah, I've been trying to think of. I have never, that I remember, ever had to call another dentist. Thank goodness. I had a patient come back to me talking about a filling that I did one time that they went to another dentist and the dentist told them that it needed to be replaced.
Mm-hmm.
It was a buccal pit on lower left molar, if I remember right. And the guy had said it needed to be replaced. And when they came back and I took a look at it, I had, there was nothing wrong with it. I was like going, what? So I don't know what that was all about. But they never called me about that. But I've never had to call another dentist. I hope I never have to. Like, I think Marcus hit it spot on. I think that's exactly how you would approach it.
Yeah, I think so. I can see it being an issue if the patient comes in and says, well, this dentist said this about the work, and then it's like, well, okay, let me call him and see what he really said. I know a dentist that I had heard, he had told me that a patient came back and was saying, well, I went and saw this other dentist and he said this needed to be fixed and this and this and this, and this dentist said, well, I know this dentist. Let's call him and just have a conversation with him right here, and let's put him on speakerphone, and then we can get to the the truth of everything. And then the patient started kind of backpedaling. Well, he didn't say that exactly, and so sometimes you get these stories from patients that aren't entirely true. So I think if maybe if something doesn't match up or they seem like they're not totally telling the truth, then maybe that's the time to call the other dentist. But yeah, that's kind of a difficult conversation to have if you're calling the other dentist, and he might think you're accusing him of something, but just so you can get on the same page, because like Troy said, Mark said, none of us are perfect, and we always have some, I don't know, not ideal outcomes, and it's bound to happen to everybody. And our malpractice insurance will tell us that everybody has a bad day, but you better call that dentist before you start bad mouthing him, which they say to never bad mouth another dentist, which is excellent advice. Before you bad mouth him, you should call and see what the situation was. I mean, maybe the patient wouldn't sit still. Maybe they were, not cooperative. Maybe they didn't actually get a filling done that day. I don't know. I've had all, we've heard it all. So,
yeah. I mean, I can think of cases where I've had a patient come in and I've done the exam and I've thought, this seems like a nice enough patient, seemed pretty reasonable.
Yeah.
Should be pretty straightforward when they come back for the filling or crown or whatever it is. And then you get them in the chair for actual treatment and you're like, holy crap, what is it? I mean, whether it's their tongue is just as hard as can be, keep out of the way. Yeah. They don't open the way that you thought they did when they were in the exam, or they're like scared to death, so they're just not. Anyway, there's a number of things that can go wrong and make it so that treatment that should have been a slam dunk is anything but, and you just hope it turns out okay, and there's a good chance that something could go wrong, and then they could go to the next guy, and the next guy could look at it and go, whoa, what in the heck is wrong with that dentist?
I had somebody recently come in, and he had just moved to my area from out of state, and kept complaining about this tooth that was hurting him. And he said, well, it shouldn't hurt. I just got a root canal done. And I looked at the root canal, and it was probably 3 or 4 millimeters short of the apex where it should have been. And so, I was just honest with him, and I told him where it should have been, and what I prefer to see on root canals. And so I recommend they see an endodontist, and at that point it's up to them. You can either do it or you can't, and it's not something I'm going to retreat, and it's better to get a professional's opinion. I don't consider myself a root canal professional enough to do a molar endo. So yeah.
Have you guys ever seen something that you did actually go, wow, that's really bad, that's that's horrible, like that's obviously beyond, like, I can't think of something that I've seen.
Right. Yeah. The only thing I can think of is, like a root canal that's kind of short of the apex, or maybe goes out the apex. But even then, we've talked about root canals being such witchcraft that you don't know if they're going to work or not. I mean, we've all seen the silver points that have been there for 30 years and they're extending past the apex and they're still fine. And so, that's what I was thinking when we started talking, that I don't see something that's just like, man, this guy looks like he's never been to dental school, or this lady looks like she's, this is her first filling she's ever done. So I don't know. What about you, Troy? Have you ever seen anything
I've
super
seen,
bad like that?
A post out the side of a tooth.
Oh, okay. Well, that's
and the patient didn't even know, or said they
didn't even know, was asymptomatic.
Wow.
Absolutely mind-boggling. Yeah.
Wow.
And it was doing just fine. It wasn't like it was failing. The only one on the X-ray. Absolutely crazy. Yeah, you got a post sticking out the side of the tooth.
Wow. Incredible. Things probably heal up just fine. Yeah, that's amazing.
I bet that tooth was super stable too, because the anchorage.
They were anchoring out the bone.
Wow. I've had some people that have come in and they've had kind of a, not an ideal outcome. And, I've given them the option of either going and seeing that dentist and just saying, hey, maybe have him just take a look at this, or see what he thinks. Cause, I didn't do it, so it's hard for me to judge. So, if you feel like you would like to go back to him or her and have them take a look at it, fine. But if you're going to, stay here in my office, then I would recommend doing this. And usually people are pretty reasonable. Sometimes they'll want to go back and, see if they can get it for free. But, sometimes they're willing to pay at your office and whatever. But so let me ask you guys something else about patients that come in for like a second opinion on treatment that they've had diagnosed or done at another office. But let's talk about things that have been diagnosed. So if a patient comes in, I have this happen quite often when they come in and say, I was told at this other office that I need 5 crowns, and it just didn't seem quite right. And I had one patient that, and we may have all had these, where they come in and say they were told they need 4 quadrants of scaling and root planing, and they, well, I always brush and floss. I've never had that before, and now I have to. So how do you guys handle that? Or do you handle it any differently if somebody comes in, you feel like they've been overdiagnosed and they're looking for a second opinion?
I'm usually a little bit leery to start off with because I mean, on one hand, I don't mind being having somebody ask questions and want more information. But on the other hand, I feel like this person seems like they really have trust issues. And so,
Yeah,
if they decide to come to me, are we going to be able to establish like some level of trust and understanding? And but then, if the other dentist told them they need 5 crowns and I tell them they need 3, then I'm the hero and
yeah,
they
it's
love
true.
me.
It's true.
Yeah.
Yeah. And yeah, I think Troy has said several times that if you ask, 10 dentists their opinion on some kind of treatment plan, you get like 13 different opinions. So Troy,
Exactly.
You do. That's
so Troy, how
absolutely.
do you handle those cases when you get somebody comes in and you feel like they've been overdiagnosed?
I just explain to them what I'm seeing, and I leave it at that. I have had, there have been times that I have seen that where, somebody has said that they've needed a crown or whatever on something, and the I guess the one advantage of being a dentist for as long as we have, 18 years now, is that we can kind of tell, what'll last, what won't last, and so, in
Yeah.
some instances, not in all of them. But like you got a little craze line or something crazy, you're just like, that ain't nothing. I wouldn't, if I crowned everything with a craze line, I'd crown every tooth in the mouth.
That's true.
Yeah.
That's true.
You just have to
Yep.
use your clinical judgment and your personal experience. But I will say I won't crown a tooth if I don't feel like it, needs to be crowned. I'm not gonna. I guess my problem is I may have a problem with undertreating versus overtreating.
Yeah. Right.
I would rather not drill on a tooth than to drill on it unnecessarily.
Yep.
So I have an issue with that myself, and that's my own problem, not necessarily anybody else's. But yeah, I just tell them what you see. This is what I see. I don't see the need for these crowns. I'm not sure exactly what they were seeing, what they wanted. So we'll keep an eye on it, and if you start having these blah 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 symptoms, then let us know, kind of thing.
So I'm going to give you guys another real life thing that happened to me, and I want to know how you guys would have handled this. So had a lady come in, and she'd been going to a dentist that I know of. I don't know him really well, but as far as I know, he's completely ethical and a good dentist, and everything is on the up and up. And um, she had come to me wanting 6 anterior crowns and wanted a second opinion on what kind of materials I would use and what kind of how I would prep them and things like that, like kind of weird stuff. And she had been to this other dentist and he had recommended, it was like, zirconia crowns or something like that. And I don't know if she had studied up her, dental materials book or something like that, but she came armed with a lot of information that seemed like too much information. But how would you handle that situation if they come in looking for a second opinion and almost like questioning you and trying to test your intelligence and your professionalism and your knowledge on dentistry? I don't know. Is that a red flag for you guys? Troy, let's start with you. And how would you handle that situation?
Absolutely a huge red flag. Since my family doesn't listen to my podcast, I'll give you an example. My one member of my family had to have 5 implants. She's missing 5 permanent teeth, so she had 5 implants when she turned 19. My niece and my brother and sister-in-law went to some prosthodontist or something where they live, and they were saying, this prosthodontist actually caused the problem. She wanted them to
Your
go.
family was saying that.
Well,
Yeah.
yes, but
Okay.
she caused a problem for me because I was going to restore the
Oh,
implants.
I
She was
see.
going to place the implants. I was going to restore them.
Okay.
And what happened was they put so much fear into my family, in my brother and my sister-in-law's mind that things had to be done this exact way or they couldn't be done. Like
Yeah.
she says, you need to go and interview my lab. You need to look and see all these different things that I have done and look at the work that I've done through this lab and blah blah blah. Make sure that you get this done. So
Yeah.
when my brother and sister-in-law called, they says, "Hey, you know, what lab do you use? Would like to call them and interview them, and would like to go over to the lab and all this stuff." I go, "What?" You know, I'm just
Yeah.
like, I'm blown away. I'm like, "Who
Yeah.
told what? This is not
Wow.
common. This is not common." And
Yeah.
they says, "Oh yeah, this prosthodontist said we have to do
Yeah.
this. We just
Yeah.
we have to do it." So I basically told my brother and sister-in-law, I says, "Look, she's got an expectation. She's put it into your head. She's going to restore them. I am not touching these things with a 10-foot pole."
Yeah.
And that's on my family member, right?
Yeah. Yeah.
And I just says, "Look, anything goes wrong, you're going to blame me. I've done this millions of times, not millions, of course, but I've done this thousands of times. I know exactly what I'm doing. I've done it
Yeah.
over and over and over." And in that situation, because of that expectation that that patient had, which happened to be a family member, I said, "No, I'm not doing it." And that's the way that it would be. You know, if someone comes to me and says, "Hey, I had a quote, you know, down the road, 6 crowns, sir. What will you do it for? Blah blah blah." I'm not
Yeah.
into that
Yeah.
stuff, man. Go
Nope.
down the road, go back to them and do it.
Yeah, I've
Absolutely.
run into similar things. I mean, where, or maybe a similar situation where a patient will come in predetermined what they want done on their tooth, you know, before you've even examined them. And then no matter what you say to them or what options you give, you know, they know what they want. Or maybe that what they want isn't even an option. You're like,
Yeah.
I don't think that's a good choice. I hate it when patients do that. And I've gotten to where I just tell them, hey, you know, that's fine. It's your mouth. If that's what you want, you can do it, but I'm not going to do it here. You'll have to go
Yeah.
somewhere else.
Yeah.
Yeah. Similar to kind of what you're saying, Troy. I mean,
Yeah.
as a dentist, you have to retain some, just like the patient has autonomy, we have to have autonomy too, to be able to call the shots and make decisions that we feel confident in and that we feel able to produce, and the patient can't dictate all that, I think.
Yeah, I think that's
Absolutely.
great. And when we were first out of school, at least I felt a lot of pressure to do everything. Like if somebody came in my office and wanted certain treatments done, I felt pressure to do it all so I could stay in business. And I think now that we've been out of school long enough, we kind of realize there's some patients like this one we talked about, and like Troy's family member, that we don't want to do anything on. It's not worth, if it was a $10,000 case, it wouldn't be worth it. It's
Yeah.
just not worth the stress. So yeah, I think if there's any advice we'd give to younger listeners is that don't worry about losing a patient over something like that, because they're probably not going to be worthwhile patients anyway. I'm
You'll
going to give
never
you
make them
another,
happy either.
and you'll never make them
They'll
happy.
never
Yeah.
be happy.
Yeah, and it's just not worth it. And this patient, she didn't come back to me to get the crowns done, and I was extremely happy she did not. So I had another situation. I'm going to ask you about this one, Marcus. So I had a patient come in. I had not referred her to get any implants done or anything like that. She just came back and already had some implants in, and I said, "Oh, what? Who?" I started asking her, "Who did the implants? This and that." Well, this prosthodontist in my town, near my town, did them, and one of my friends said I could go get those done, and so he did them, and then he put the crowns on them and everything. It was great, but it was like $10,000, and I thought, okay, whatever, that's fine. And about 6 months later, and I had referred her to an endodontist too to get some other treatment done, but about 6 months later, she came in and there was a little crack in in the porcelain of the crown, and I said, "Now I just want to point this out to you that you have a crack in this crown." And she said, "Oh, well, I know who did that. I don't think you did it." I said, "No, I absolutely did not do this crown." And I said, I think the prosthodontist put that on you." "Oh, no, it was the endodontist that put it on." I'm like thinking, well, the endodontist doesn't do crowns. So
Yeah.
have you ever had these situations, Marcus, where you're trying to explain to a patient something and they just aren't getting it through their heads? And do you just give up, or do you just let them believe what they're going to believe, or how do you handle that?
I don't know. I mean, in that case,
It's
I'd probably
weird.
just be like, I guess they're going to believe what they're going to believe. If
Yeah.
I don't know how to convince them otherwise, but I know what you mean. You run into patients like that think they know something that they clearly don't know. And at some point, unless it's going to directly affect you, or it's going to have result in some horrible outcome for them,
Yeah.
you probably just let them, okay, you believe whatever you want to believe. Go ahead and call the endodontist, and he'll tell you, and he'll even prove it in his chart
Yeah,
that he never
in his
placed a
chart.
crown.
Yeah, yeah. And she actually did that, and the endodontist office said, no, we don't do any crowns. She called the prosthodontist office, and they said, no, we didn't put that crown in your mouth. And she's like, those are the only, you and those two are the only three dentists I've seen. Like, well, I didn't, and so I don't know but then that's another thing that I don't know if she's, totally telling the truth, or if the prosthodontist office just lied to her or something. I don't know, but
Yeah.
that really isn't that hard to figure. It shouldn't be that hard to
Call
figure
your
out,
insurance and find out who billed for it.
yeah, that's it. Yeah.
Yeah.
Well, that's the thing. She didn't bill her insurance because, of course, the prosthodontist didn't take her insurance or something like that. And he made it sound like this was some amazing thing. Like like you said, Troy, about the other prosthodontists that kind of talk the patients into coming to their office by kind of putting down other dentists, I think sometimes. So I don't know. Maybe I
Yeah, they
shouldn't
do.
say that about all of them. But
Not all
sometimes.
of them, but some of them do.
Yeah, some of them do.
Buddy of mine sold his practice to a prosthodontist, and when the guy comes in, and he found himself redoing a bunch of the work that my buddy had done, and was sending the bill to my buddy.
What?
Yeah, he's saying, oh, this crown needed to be redone. Oh, and he's looking at the X-rays, going, no, it didn't. No, it didn't. No, it didn't. I want to see all this stuff. And the guy was bad mouthing him, and I mean, just horrible stuff. It's like, there's no place for that.
Yeah.
There's
No.
This is ridiculous.
That is ridiculous. I've heard of. I had one dentist tell me that he knew of another dentist who had done a root canal. It failed. He had to send the patient to the endodontist. Well, the endodontist apparently sent the bill to this dentist who had the root canal fail. The dentist in turn sent a check for $30 and said, this should cover your files. I'm like, what kind of I don't know. I just that's not like me.
It's one way to never get a referral.
Practice.
Yeah.
So I've never bought another practice, but you guys have. Were there clauses when you bought your practice, like on treatment that the dentist you just bought the practice from had recently done or done in the last year? If it needed redone?
I don't know, Troy. Do you know about that?
Yeah, there is okay. A clause for that. And basically what'll happen is you have to go and talk to the other guy about it, and you both have to come to an accordance with the fact that it needs to be redone, and either give the purchasing dentist the opportunity to do it and then pay them for it, or redo it yourself.
Wow.
I just kind of thought, man, I think I remember seeing that when I was looking at a practice once. But anyway.
Yeah.
Yeah, and to me, I mean, and maybe this is just me, and this is probably me just being stupid, but if I bought a practice and I saw something like that, and the patient was, being difficult about paying for it a second time, whatever, I would probably just fix it and then let it go. I don't know. I'm not sure that I would take the time to go to the seller dentist and ask for money and this. I don't know. That just seems like more of a headache to me. But
yeah, as long as it's not happening all the time, if it's every once in a while, that's not a big deal. That happens to everybody.
Yeah.
I mean, how many times do you get your X-rays back in a year after a DO or something you did, and you go, oh my gosh, there's a void there. I need to redo that. So you schedule them, you redo it, you don't charge them.
And that's my next question, Troy. How do you handle situations like that when you're like, holy cow, that filling looks terrible. Oh wait, I just did that 6 months ago or last year. Like, that's got an open margin. So, Troy, how do you have the conversation with the patient? How do you have the conversation then with them?
I just tell them flat out that I don't like the way that turned out, and I show them the X-ray on the TV, and I say, look, I want to redo this, and no charge to you. I apologize. You'll have to come back and get you numb, but I want to make sure it's right for you so it lasts you a long time. I've never had anybody ever say, oh, you know what, I just really don't want to redo that.
Yeah.
I've never had anybody do that. It's just I think that they are grateful that, when I see something that's not right, that I'm willing to own up to it, and I'm willing to say, hey, I'll do that, no charge, no problem.
Yeah.
I usually
most people appreciate
that conversation too, and I'll just tell them, and just like your orthopedic surgeon, I'm going to charge you for it again.
Yeah. It would be nice if we were able to do that. But yeah.
And it's interesting because that stuff happens all the time with, like you said, orthopedic surgeons. How many times does somebody have, a knee surgery, a shoulder surgery, and it doesn't work out, and the patient doesn't, they might be like, I gotta have that done again, but it's like accepted. But in dentistry, it's like we put so much pressure on ourselves that, we act like we should never have to redo anything.
Our
Yeah.
work should never fail. It
Never.
should last forever.
And,
Yeah, I'd like to know who started that whole thing because it
yeah,
was long before us. And that
yeah,
is true. People expect dentistry to last forever
yep,
in the
And
most brutal environment there is.
yeah,
The hot cold cycles of the mouth, the chewing, gnashing, and it's amazing that we have to sit and deal with the fact that stuff fails and
yeah.
have people think that it shouldn't have.
And when we talk about redoing something, we're not talking. I mean, we're talking about when you realize that you could have done better, that there's an obvious error or issue with something you just treated. I mean, for sure. But it is kind of you're going to replace that, but it is kind of interesting. Like why do we place arbitrary guarantees on some of our work?
yeah,
Why do we come up with 5 years or 10 years on our crowns, or why do we say 3 years or 7 years or whatever? I know a
yeah,
ton of practices. That's like a big selling point is that we'll guarantee it for this amount of time. Well, like Troy just said, there's so many things going on in the mouth. You could do the most perfect filling, and somebody's chewing on ice every day, and
hmm,
they brush their teeth, every other day. But they still show up for their 6 month appointments. So that means you're going to guarantee that for whatever your warranty is on your restore. I don't know. It's a
yeah.
strange thing we do in our profession.
Do you do
That's
you find that we?
interesting.
I'm sorry, Ryder. I didn't mean to cut you off.
No, go ahead. I want you to go ahead first, right?
Um, I'm thinking that we do it based on insurance. We
Yeah,
allow we
That,
allow
yep,
insurances to determine that, right? So, like for
yep,
example, crown is a 5-year thing. A filling
yep.
is what, a couple years. So
Usually two, yeah,
everything has to last, you know, until the insurance will do it again.
yep,
You know,
because
that's the
heaven
thing. It's
forbid a
that's
patient pays for it out of their
correct.
pocket.
Yeah, I've had situations where people come into my office and somebody shattered a crown that was in there for 2 years.
hmm,
It's like, well, sorry, your insurance doesn't cover it for another 3.
yeah,
Not one that I've done,
right.
just that they've come off the street, whatever. And I'm like, what can you do? You can't just say,
What
I
can you
gotta
do?
leave this thing, gotta leave this thing wide open for 3 more
Yeah,
years till your insurance will cover it. I think it's ridiculous.
Yeah,
Like my
yeah,
it's
wife,
stupid.
she had shoulder surgery 3.5 years ago. Looks like she's gonna have to have it again. Same shoulder. We're sure enough gonna get a bill on that.
Yeah,
yeah.
You know?
yeah. There's no
I mean,
5-year guarantee on that thing,
if she would
and
have had
it's
to have it
accepted in
3 days
medicine.
after again, she would have still had to have it paid for
Yep.
again. What
Yeah,
happened to dentistry? Why did this happen?
I
I
don't
don't
know.
know. And the problem is the insurances won't pay for it. But the bigger problem I feel like is that patients believe that whatever the insurance says is gospel truth.
Yes.
And yeah, if they say
Yeah,
it should last 5 years, it should last 5 years. Well, yeah, but you have like a PFM in somebody's mouth and they're, like you said, chewing on ice or something like that and shear off some porcelain. Well, I can't guarantee that I can't put like a 5-year guarantee on that. I
yeah.
I don't know.
And you're not
I
even the
had a
lab that made the porcelain or
right.
baked
Yeah,
it,
they
or
should have interviewed. They should have interviewed that lab first. Is what they should have done. That patient should have
God,
called that lab. Like,
you got to go to your lab. If you're a patient, you're listening to us. You've got to go to the lab. You got to interview them. You got to talk to them and see what
oh my
kind of
and
god.
person.
drill all the way down to the technician that will be doing your case.
Yes.
Find out
Yeah.
about where he
Okay.
went to school, how if he's find out about his family, get his transcripts from his high school.
Yes.
You might want to call the supplier who sends the porcelain to this patient or to this
Yes.
lab. I don't know. You got to do your due diligence, guys. Yeah, I had a patient. It was 2 weeks ago, I think. I put a bridge in her mouth. I think in June or July, lower left. Came in. I've never seen this happen. It was a zirconia bridge, and it had fractured between. It was from I think 29 to 31. It had fractured between 30 at the pontic and one of the abutments. I'd never seen that before,
Wow.
and it happened when I was out of town. She and I have another dentist that will see my emergencies if I need to. Is just a guy I know down the road's a nice guy, and we cover for him too. and she had gone in there, and he said, I've never seen this before. And decent guy, he called my office when I was gone and said, I saw this, I just told her to come back and, have you take a look at it, see what you can do to fix it. She came in, was fine, was not mad. I told her, well, I'm gonna have to cut the rest of that off and make you a new bridge, and I'm sorry. And we got her a new bridge in there, and it was great, and she's happy as can be. And I thought that was an ideal way of handling all of those situations with the dentist that saw you. I mean, he could have easily said, this is the worst bridge I've ever seen. You really shouldn't be going to that office, and you need to come here. And with the evidence of the bridge breaking, she probably would have believed him. I don't know. I just, there's good ways and bad ways to handle things like that.
Yeah, for sure.
Yeah, and that's another thing, you don't want to throw your lab under the bus either, because,
Right.
the reality is crap happens,
Yeah. Yep.
There is no way to guarantee that anything we do ever in anything is going to last forever.
Yeah.
Or last at all. There are way, 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 way too many factors involved. And so, I don't guarantee people stuff. I don't say, oh, this is going to last you for, however many years. I'll say, I don't know. If I always bring up the thing I says, if I had a crystal ball, I could tell you.
Yeah.
I like the
ball. I would be doing that. I'd be a
if I had a crystal
on...
ball, I would be, retired.
Yeah. And, usually giving a range, I'll usually say, a crown should last 5 to 10 years, but, some will last longer. Some won't, depending on how hard you are on it, it won't last that long at all. So most people are pretty accepting of that. And I think if you give them the worst case scenario and it happens, then they're okay with that. Yeah.
You guys have heard the saying, under promise and over deliver. I think in a way that's the thing to go by. I mean, set expectations. I'm not saying like tell everybody everything is going to suck and it's going to be horrible and it's never going to make it. And, don't need to paint a disaster, but I sure wouldn't go out of my way to tell people, oh yeah, this gold crown, gold wears so well, that's going to last forever. I've seen patients with gold crowns that have been there 40 years, or whatever the scenario, I'd never like go out of my way to try to make something sound like it's just amazing and it's never going to fail. Let them know that gold crowns work really well, but you can still get a cavity around it. And, if we get a few years out of it, that'll be great. I don't know.
Yeah. And I've told people that, crowns will, gold, especially gold, that crown will last a long time. The tooth underneath it might not, you might get decay underneath there, and gold might still be fine. But, and we get a lot of times people saying, oh, I didn't know you could get cavities underneath the crown. Like, how did, who started that rumor that you couldn't get cavities underneath the crown? I don't know.
Well, that's it's not their tooth.
Yeah, it's not. Yeah,
How many times you get that?
That's
this
true.
is my Oh.
Yeah.
It's a gold tooth that somebody hammered into my skull. They don't get it. I don't blame them. A lot of
it's true.
It's like accounting. I don't understand accounting.
That's witchcraft too. Accounting and endodontics.
They don't realize it. Yeah, that's your tooth.
Yes.
We just glued that crown over.
Oh well, guys, how do you tell your friends if they're subpar? How should I have that conversation with my two?
Well, I just tell you. I'll tell you, guys. I'm not worried about that.
One of us on here can organize an online meeting but can't seem to start it. So
Yes,
that's true. We were waiting around.
Yeah, I do my best. I try. Well, do you guys have any more advice or any other pearls of wisdom or anything for the listeners?
Never throw anybody under the bus.
Yeah, that's excellent. Yeah, that's excellent advice.
That's just one of those things that I think is just best to do. Don't ever criticize someone, and no one's perfect.
Yeah.
Dentistry will fail eventually at some point.
At some point. We were gonna dissect the ADA code, but we're not gonna do that tonight because we've already gone on long enough, and that might get kind of boring. So yeah. I like Troy's advice to not throw any dentist under the bus, especially before you've talked to him about it. And you don't want somebody throwing your work under the bus or literally throwing you under the bus. Nobody wants to go under a bus.
No.
Some days in dentistry make you feel like that, though. You may feel like you've been run over by a bus, but
Might feel like
you
you
know,
want to jump in front of a bus, but
you might feel that way. Today, here's one more story. I was sitting in my office today at lunch, and one of my hygienists comes back and said, "Did you just hear that?" And I said, "No." She said, "Some lady was just walking by in front of the office and said, 'I want to die.'" And then she just kept walking. I thought, well, lady,
Outside?
sometimes I feel that same
Outside of
way
the-
after doing some dentistry. So whatever.
Oh my goodness.
wow.
Heavens.
Keep an eye on her,
So
huh?
yeah, I guess keep on walking, lady. Don't come in here.
Was she talking on the phone or something, maybe?
No, she was just talking to herself. Yeah. So
It's like the poor people that we saw walking in front of our dental school when we were going to
oh yeah,
dental school.
yeah,
Man, there was some people down that way that really had some struggles.
yeah,
Oh, for
yeah,
sure.
yeah. That was by a halfway house, wasn't it? I mean,
Yeah.
something like that, something similar. So yeah, yeah. And in that lady's case, I have no idea what she's going through. So whatever. Won't throw her under the bus either, I guess, because
Don't throw
you
anyone
don't
under the
know.
bus.
Um,
No
you
one.
don't know what people are going through. Yeah,
Exactly.
a lot of stressful things right now. So anyway, Marcus, do you want to tell everybody where to find us? Let us know if they have a topic they want us to talk about, or whatever.
Yep. Send us an email to dentalrealist@gmail.com. We love to hear from our listeners. We appreciate everybody who listens. If you have a question about tonight's podcast, other podcasts we've done, things you'd like us to talk about, send us an email. We love to hear from our listeners, and we usually message you right back. Also, we have a couple of books that have been out for a little while. So you want to be a dentist, and so now you're a dentist. Both excellent reads and packed full of important, uh, earth-shattering information. I didn't
Oh, packed
oversell
full of
that, did I?
information. Yeah. Yeah. I think you just blew your own thought out of the water about undersell and overdeliver. I think you oversold and possibly underdelivered.
Maybe I
That's
got that
good.
wrong.
It's good for everything else in life. So, yeah, we appreciate everybody listening. But yeah, let us know if you have a topic you want us to talk about, email, question, whatever, and we will get to them. So this has been episode 59 of the Dental Realist Podcast, and we'll talk to you on episode 60. Thanks.